Continuing our conversation with Dr. Stephen Malloney, let's talk a little bit about childhood obesity. It is a very serious problem, and I would imagine if kids start out eating wrong, then they do it for a lifetime.
Mm-hmm. Very true. Our diets these days are, we're in a fast-paced society, so there's a lot of people eating fast food and eating a lot of unhealthy foods, and it's definitely contributing to this, which I would call epidemic at this point.
So I understand it's a very serious platform of yours, and one that I know you want to go out and speak to civic clubs and things like that in the future. But what are you telling your patients now? I mean, I know the parents are in charge, but many times parents forget that. Yeah,
well, I think number one, parents, there's a stigma associated with obesity and overweight, so they don't want to, diagnose their child with that, and so they're afraid to talk about it at times. But the big stepping point is healthy lifestyle. We need to talk to parents about that, because even if their child is overweight or obese, simple changes in lifestyle can actually help and get their children back to a nice healthy weight and healthy lifestyle.
Before we even talk about the physical, we have to remember the mental aspect of kids teasing other kids because they're chubby or fat, or just making them feel insufficient about themselves.
Exactly. The social stigma associated with it is very bad. And in addition, there's psychological aspects to it: depression, fatigue, things like that can really affect these children. So it's a serious problem that needs to be addressed.
So how do parents take that first step?
Well, they need to, number one, I would go see the pediatrician and find out exactly where their child falls into that category, whether it's overweight, or obese, or not. And that's simply checking the height and weight of the child for their age, and it'll tell us where they fall in which category.
So we all know that kids are at school a lot and they can eat the wrong things at school, but while they're at home, what should the parents do to change and make a difference?
Well, first and foremost, with kids especially, you need to change their lifestyle, their activity. Most kids are watching TV, playing video games all day long, and not getting out and getting the exercise that I used to get when I was a child, or used to get when you were a child. So a good 45 minutes to 60 minutes of activity per day will help. That's number one. That's the most important. And then there are some simple changes you can make to lifestyle, diet, and what have you that can really go a long way in getting your child healthy again. First and foremost, beverages. Most kids are drinking a lot of juice, a lot of soda. There are studies that show if you drink 2 cups of juice a day, your child is more likely to be obese than not, and that's just 2 cups. And then all the fast food. I'm not telling parents to cut it out. I'm telling them to just cut it in half. It's if you're going 5-6 times a month, cut it down to 2 or 3, and don't supersize. We got to stop supersizing. Eating with your family at the kitchen table as opposed to in front of the television or the computer will help. You'll eat a lot less that way. Those are probably the biggies, and then there are other subtle changes you can make, like changing the milk that you're drinking, and a few other things in your diet that will help.
I guess one of the sad things is that most parents didn't learn how to eat right. I guess a lot of them just don't have the knowledge themselves to steer the kids on the right path.
I think you're right. It's knowledge and time. Fruits, vegetables, and healthy foods that you prepare at home take time. And a lot of parents, you have two-parent homes where people are working, and they just don't have the time to prepare meals like they used to. And I think that's a big part of it as well. So, getting a nice fresh prepared meal with fruits, vegetables, and what have you, less fried food will also go a long way in helping this.
Of course, we realize that obesity also can be hereditary. So do you think that a lot of parents just blow it off as that, hey, we're fat, they're fat, the kids are fat, everybody's fat?
Yeah, I think that's part of the problem. And I think if you look, a lot of it does run in families. So, if you're diagnosing a child as being overweight or obese, you may actually be, diagnosing a parent the same, and they don't want to hear that sometimes. But once again, changing the family lifestyle, how they eat their meals, when they eat their meals, will go a long way. There are subpopulations that are at risk for obesity. You have non-Hispanic African American females and Mexican American females for some reason are at very high risk, as well as Mexican males are at high risk for obesity. So those are populations that we have here that we really need to keep a close eye on.
We've got about a minute to go, and I just wanted to ask you, what should parents be putting in their kids' lunch boxes? Give us a good menu.
Well, most kids are getting the school lunches, which aren't the greatest, and I understand why that needs to happen. Once again, it's a time issue, but a nice sandwich with whole wheat bread, not white bread, will go a long way. Maybe some fruit or some vegetables in their lunch will go a long way. And the juice, you got to cut out the juice in the soda. If you're going to give your child something like that, get a flavored water or a low-calorie juice. A lot of the juices now have 10 calories in them. Just buy those, and that will go a long, long way.
Wonderful information. I hope you do make the rounds to the civic clubs and educate everyone. It sounds like it'll be the best place to start with the adults to pass it down to the kids. Stephen, thank you so much for being with us here on 30 Minute Medical.